All right, well, that is my summary on most of the injectable medications you'll be on. This is usually exactly how I do a calendar review with my patients. There are going to be more medications that you may be prescribed, and I probably want to go ahead and just touch on those a little bit. I wanted to dedicate time to each of those injectable ones that I know sometimes can cause a little bit of stress in that. But in general, I know there are other medications out there. For example, you may be prescribed medication like other fertility medications like Brevel or Menopur. Those often actually come in the same kind of format that Luveris does, in a powder water situation. So if you find you've been prescribed and you need to use a Menopur every night, you could basically follow the instructions I've just given you for how to mix a Luveris. It's the same type of thing. You might notice some modifications. I mentioned this when I did Luveris, that sometimes the doc will tell you, you know what, you don't need to pull up 1 ml of water to mix a Luveris or a Menopur. You only need a ½ ml of water. Again, each clinic will have their own medication instructions attached to this website, so make sure you get familiar with those. Because again, this was more of just you and I talking and having a general sense. I wanted you to get a little bit more secure about how you're doing things. Not to worry and stress about things as often as sometimes that we do. And sometimes I know just watching me do something, you really probably already know how to do it, but just seeing it one more time before you do it gives you a little bit more security, and that's kind of what this is about. Like I mentioned in the beginning, if you have any questions or maybe something about the way your medications look or needles and syringes, that it's not jiving, then please make sure you call your office. You remember, after hours and weekends, you've always got a nurse on call, so you're always able to reach somebody. So don't think you're alone out there, because you're not. Other medications that might come up. Certainly, most of you are going to prescribe some kind of oral medication. Steroids. In almost all IVFs, the doctors have you on some form of a steroid. Usually it's a low-dose steroid. You're on it for its anti-inflammatory benefits. Dexamethasone is probably the most common. Some doctors will prescribe prednisone. You'll see it on your calendar. It's usually 1 pill every day. Most important thing with the steroids is to always take it with food. Steroids can upset your stomach, so make sure you're always taking that guy with a meal, I prefer. Now, side effect wise, a lot of people ask, am I going to gain that weight from the steroids, etc. Well, sometimes you might notice you get a little puffy, a little bit of water weight, the kind of thing that I wouldn't notice, but you would probably notice. You might pick it up easy, but you usually lose it easy as well. Other times, some patients say they actually get an increase in appetite. They get hungry when they're on the steroids. And you know what? They eat more. And you know what? That's real weight. So that's tough. You got to kind of watch that sometimes. But again, that's a temporary side effect of the steroids. Sometimes the steroids can give you trouble sleeping at night. If that happens, I recommend you try to take your steroid in the morning. As long as you're taking it with food, that's the most important thing. Different people are on different types of steroids depending on your situation or certain immune test results or whatever the doctor thinks is best for you. Vitamins and supplements. Most of the doctors are going to have you on either prescription strength folic acid, prescription strength prenatal vitamins, Folgard, which is even higher dose folic acid. These are pretty basic medications to take, oral medications. Usually we don't dictate when you have to take them. Sometimes the prenatal vitamins can be a little heavy. You know, you need to take those with food because they can cause a little nausea. But otherwise, they aren't anything that interacts with anything else I'm giving you. So it's pretty open as to when you can take any of your vitamin type things. What else? Some of you are on estrogen patches. Some of the docs, part of their estrogen priming is to be on patches. Generally, the patches are changed once a week. Sometimes, depending on your specific protocol, you might find your doc has you on patches every day. These are just patches that are usually attached to the abdomen. And again, depending on your medication calendar, you'll just pay attention if they change daily or they change every week. Other medications that generally are always part of everybody's protocol are suppositories, vaginal suppositories. Now, there's a very important message here with suppositories. These are always vaginal suppositories, 1. 2, these things all look alike. I don't know why a pharmacy can't make these guys look a little bit different, but all the suppositories look exactly the same. So please make sure you read the labels. Some of these suppositories are estrogen only. Sometimes they're progesterone only. Sometimes they're a combination of estrogen. You'll usually see that written as E2V. E2V in progesterone. Some of you might be prescribed Viagra vaginal suppositories. Some of you are prescribed an antibiotic vaginal suppository. Like I said, they all tend to look the same. Please read the packaging. It's very important, for example, that you were never to take a progesterone type suppository while you're stimulating. Very easy mistake. And, you know, with all the injections you do, it seems like the suppositories, you know, one of the easier things we can, you know, focus on and don't have to think a lot about. But the truth is suppositories have many times canceled cycles on patients. So just read the labels. That's all. Just stop and read the labels. This is one of the reasons I like to really cut down on the amount of stress involved with all of this, because it's just the stress and the being worried about so many things that make us do just silly, careless things that it can have a lot of repercussions. Suppositories generally are always kept refrigerated for the simple fact that they're much easier to use when they come out of the refrigerator. Okay. Depending on the reason you're using them, generally there aren't too many side effects, except for just you want to make sure to wear a panty liner, etc. with these guys. Generally, suppositories are done at bedtime. If you are somebody who's doing multiple suppositories a day, like Viagra, for example, that's done 4 times a day, I usually tell folks do something like a breakfast, lunch, dinner, and bedtime. Just try to spread them out throughout the day. Immune treatment. Sometimes you're prescribed blood thinners like Lovenox, or I should say less frequently, heparin. Lovenox is probably something that's more common. Lovenox is such a basic, you'll see when you get that medication, if you are prescribed that, it's really, again, in its own syringe, it's loaded up, ready to go. You take the cap off and it's a sub-Q injection. So if you are prescribed something like that, I always like to let my patients know it's just another sub-Q injection. But because it's a blood thinner, you might notice a little bit more bruising with that kind of injection. Nothing to worry about, just a little bit more bruising. Sometimes on that note, when you're doing these injections, all of a sudden one morning you'll notice, I got more bleeding with this shot. And you'll worry that you lost some medication from the bleeding and that type of thing. Sometimes you don't realize it, but you're doing injections over spots where you did injections last week and, you know, they're tender underneath the skin and you might have, you know, some bleeding. Just keep pressure and you're not losing any kind of serious quantity of medication where I'd ever tell you to go ahead and do a second injection. So again, don't stress and worry about those things. Those are very common things that can happen. I don't think there's anything else in specific. There's new medications coming out all the time. Some clinics are starting to use human growth hormone. Again, that's a mixing situation where I'm probably best to direct you back to your clinic, or make sure you check out your clinic's medication instructions because I'm sure it'll be written in there. But things are going to be changing and we'll be updating this video as if things become more popular, etc. But again, remember, this is just to help support you while you're doing this all by yourself, because you're not all by yourself. You can always contact us. You can always, no matter who you are, where you're at, you're always welcome to email me. My email is lindav@sherinstitute.com for just anything, something comes up, or just questions or clarification, or you feel like you're my buddy now and you want to email me about something, go right ahead. Been doing it a long time, so I'm there to help you. Otherwise, like I said, make a friend with your coordinator, make a friend with your doc, and remember, we're here to take care of you, so don't hesitate to let us know when we can help you. Good luck.